Hi, I'm Jeanne Schumacher. I'm founder of Simply Plant Based, where I have a lot of programs to help you to change your health destiny. Today, I have the pleasure and privilege of interviewing Dr. David Dunaief. He is an internist specializing in lifestyle medicine. His focus is on reversal, prevention, and treatment of chronic diseases through nutrition, fitness, and stress management. And he's got practices on Long Island and Brooklyn. Dr. Dunaief, thank you so much for taking the time to be with me here today.
Well, it's great to be here. Thank you for having me, Jeanne.
Well, okay. Article number 2. Okay. So well done to you. Second article in the Journal of Lifestyle Medicine. So kudos, right?
Yeah,
So
the American Journal of Lifestyle Medicine, what a prestigious journal. It's wonderful to be published there. Once daily, low inflammatory foods every day, Life Smoothie, or the full life diet lowers C-reactive protein and raises plasma beta-carotene in 7 days. That's a mouthful.
that is a mouthful, David, honestly. So, okay. So the title, though, does, to me, sound interesting because, well, first of all, you started me on this, and I also am experiencing a lot of the things that you're seeing in your study. So I can verify a lot of this myself. So before we start, let's define some basics for people they're just watching this for the first time or hearing about this for the first time. What is CRP and beta carotene? How do we measure them?
So CRP stands for C-reactive protein. It's an inflammatory factor, and we're focusing specifically on high sensitivity CRP so that we can get people to optimal levels with their inflammation. And we're also focusing on beta-carotene, which is a nutrient level, and you get beta-carotene to increase, and this is the goal, to increase the beta-carotene through eating dark green leafy vegetables, not from other sources such as starchy vegetables like sweet potato or green powders. Those don't have the same effect in terms of increasing the nutrient level while decreasing the inflammation. And that's the goal here, to increase the nutrient level while decreasing the inflammation. And both factors are measured through blood tests, and they're referred to as serum beta-carotene and hsCRP.
For the people that are just learning about this, what kind of diet are we talking? Are we talking paleo, Mediterranean, keto? What are we talking? And what does life stand for?
Well, these are wonderful questions. This is a whole food, plant-based diet. It's a nutrient-rich diet. And LIFE stands for, it's an acronym, LIFE diet stands for low inflammatory foods everyday diet. The goal is to reduce the inflammation because inflammation plays such a key role in chronic diseases. And you want to do this through nutrient density, which means focusing on dark green leafy vegetables. You can measure the consumption of dark green leafy vegetables objectively by using beta-carotene levels to tell patients if they're adherent or not adherent. So what we did was we started patients at day 0 and we measured their beta-carotene, and then we looked at it 7 days later to see what kind of increase occurred by taking in those dark green leafy vegetables. And we wanted to see those go up, and we wanted to see what impact that might have on the inflammation by having an inverse effect of decreasing inflammation. So some patients tended to say they would come in when they started the study saying, I ate a lot of dark green leafy vegetables. And they'd say, I don't need to eat anymore. I've eaten so much. And then it turns out that they're not eating as many dark green leafy vegetables as they think. They may be eating a lot of vegetables, but they're not focused on dark green leafy vegetables. So we want to get that serum beta-carotene up. And the way we do that, again, is through the dark green leafy vegetables. I hate to sound redundant, but this is one of the most important parts, that it's not from necessarily starchy vegetables like sweet potato, which has a lot of beta-carotene in it, but does not seem to have the same effect on inflammation as we showed from the previous study.
In the process of doing this study, when you first started with these people, were they all like plant-based, or were there people who were just starting plant-based living, or was everybody on the same more or less nutrition level?
No, people were all on different levels. Nobody was on a specific diet like keto or paleo, but they were on more the standard American diet. This is where people started when I was working with them. And so it was all basically all different types of foods that they were eating. It was not standardized when they started.
Okay. All right. So you had different people at different starting points.
Right. People at different starting points. Absolutely.
Okay. All right. So tell me about the differences, because I know you wrote the other paper and then this one. So what are the similarities and differences between the previous study and this current, most recent study that you did?
The similarities between the studies are we were looking at elevated nutrient levels, the serum beta-carotene, and we were looking at the inflammation through C-reactive protein. And those were the similarities. But the previous study, the differences were stark. The previous study, the time frame was basically a mean of 6 months. The time frame in this study was 7 days. We were trying to see if we can have an effect in 7 days. And that is a very short period of time. In the current study, we were changing the diet with adding a smoothie to your regular diet, as opposed to just changing overall diet. Whereas before, we changed the diet of everyone to the Life diet. This time we had a group doing the Life diet, but another group just doing one 32-ounce smoothie and doing the rest of their regular diet. In other words, one simple change of adding 32 ounces of smoothie on a daily basis for 7 days to the existing diet with no other changes makes it much simpler for patients to say, okay, I can do this. I can do a smoothie. While I might not want to change my whole diet, I can at least do one 32-ounce smoothie a day and continue what I'm doing before, and let's see what kind of results I get with my inflammation and my nutrient level.
So you had two groups.
Right.
So there were two sides and then another control group?
We had two groups. No, we had the one group that was getting the whole Life diet, the whole change in the Life diet in 7 days. And in the previous study, we had a control group because we had non-adherent patients that were part of that, making the control group. So a pseudo control group, because it wasn't specific to making a control group when we started the study. But this one, we created the control group from those who changed their whole diet from their regular diet to the Life diet, and then compared it, and there were 7 patients in that group, and compared it to those who changed to adding just a Life diet smoothie, 32 ounces,
did whatever else.
Regular diet, right?
Okay, all right. Okay, here's the $1 million question. What did the results show?
Well, that's a great question, because the results showed very similar results with adding a 32-ounce smoothie to the regular diet compared to changing the whole diet to the Life diet, so that you had to make all these drastic changes in the first day. With the Life diet smoothie, with this 32-ounce smoothie, what we saw was basically an increase in the serum beta-carotene of about 50% and a decrease of the inflammation, the C-reactive protein, by about 43%. This was amazing. In 7 days, all we did was give them a 32-ounce smoothie every day for 7 days. And they didn't have to change any other part of their diet. They just had to keep the rest of their diet consistent. And then with the other group, we completely changed their diet, giving them the Life diet, which included a smoothie, but they had to change the whole diet, and they saw similar results. They saw about a 40% increase in beta-carotene, the nutrient level, and they saw about a 35% decrease in inflammation, which again is really wonderful. Now, they didn't start at the same baseline CRP. So when the inflammation sounds like it decreased more in the smoothie group, well, the smoothie group had slightly higher CRP at baseline, so you'd see more results potentially of decrease. However, they basically, for all intents and purposes, had the same results, whether you gave them a 32-ounce smoothie with their regular diet or changed the Life diet completely in terms of inflammation reduction.
My hypothesis would have been the group that was doing the Life diet plus the smoothie, would have decreased it more, but that it was more or less the same results?
It was more or less the same results. You couldn't say, now this was 7 days, of course, but you couldn't say that there was necessarily a difference. And of course, this was done in a small study. And so it was based on inflammation. And that's what's wonderful about it. So that the importance of this diet especially comes from a large part from the smoothie. So that's so important that adding a smoothie to your diet makes a big difference. And you may not have to make huge changes in order to change the inflammation, but that's one part of changing a diet and seeing the effects. You may have to make other changes for other things to change as well. So we're looking specifically at inflammation.
But in the other study that you did, the first one, you compared it with just, you had your control group, and then these people did the lifestyle changes. Did you see a bigger change in that group? But you studied it also over a longer period of time.
Right. Over 6 months, we saw not 30 to 40% reduction in CRP. We saw 75% reduction in CRP. So we saw a much larger reduction in CRP over 6 months period.
Okay.
So there was definitely a difference, and there's definitely a difference with a longer duration. Do we know if there's a difference in terms of inflammation with adding a smoothie to the diet or changing the diet completely? We don't, but we should do a longer study to find out.
Yeah, that would be, that's part 3. That's the next one, right?
Right, absolutely, absolutely. But it's very exciting that it means that if people want to change their diet and they don't want to go out of their mind, or they don't want to have any cultural effects, or they want to be able to sit with people and still have the same dinners that they wanted before, they might be able to just change the smoothie, add the smoothie to this existing diet, the 30 ounces of smoothie with 8 ounces of greens and things like that, and you'll have this effect. And you can have this reduction in inflammation. Over the long term, will the reduction be exactly the same as changing your diet overall? Well, that would be part 3 study.
Right? Okay. So David has his next project coming up.
Right. Thank you very much.
Glad to help.
Yes, I appreciate you.
Always, right?
Right.
So have people had issues in tolerating the smoothie? Because I have to say, I mean, it's 32 ounces of a lot of fiber, and sometimes your gut biome is not ready for this flood of fiber. Have you had some people not be able to tolerate it?
Well, it's a great question. I mean, it's a practical question. When we think about drugs, we think about clinical trials, and people don't ask, well, could they tolerate it on the outside? But when you think about this, this was not only used in the trial, but this has been used in my practice for years. I've been using this smoothie. And what I see is that people do really well with this smoothie. I find that people tolerate it really well, and that it seems to work in an extremely broad population. And it's wonderful. And what I find is that almost everybody loves the smoothie. And if they don't love the smoothie, it's because they're not doing it the right way, or they don't have the right blender. You need a high power blender.
Yes.
And one that emulsifies, not just tears and rips, but you need the appropriate blender. And then people say it's wonderful. I mean, this was way back when, but I had my 9-year-old nephew and my 11-year-old niece tell me I hate vegetables. And then they looked at me when I was making the smoothie and they say, oh, does that have chocolate? And I said, well, it has chocolate in it. It's not chocolate, but it has chocolate in it. They said, could we try it? And I said, sure. And after they tried it, I was crossing my fingers thinking, oh God, they're going to say it's awful. And all of a sudden they said, could we have one? And I was like, oh my God, what a huge success. And I've had
Okay. But David, a sip of that is one thing. But let me tell you, it's a lot of fiber coming, and it's going to be coming out the other end,
Yeah.
So.
Well, if you have trouble, the way to do it is drinking it over a longer period of time. You don't have to drink it in 5 minutes and see who can chug it down the fastest. You can do it over an hour or two period of time. I mean, or you can even break it up into 2 16-ounce volume over the day. It doesn't have to be all at one time period. I, in fact, find that the faster I drink it, the more it can have that kind of explosive effect. So I don't like to drink it super fast. And so I try to extend it out a little bit more, but it can be done over a 10-minute period. It can be done over an hour period. It can be done over a 2-hour period.
Yes, but it also has, we put a little bit more flaxseed in ours, you know, so it tends to gel up a little bit, from the flaxseed. So anyway, have there been other studies that have shown these results in such a short period of time? And we're talking 7 days.
Yeah, there has not been another study to my knowledge that has shown results like this in 7 days using smoothie, the Life Diet smoothie, 32 ounces, or using the Life Diet overall. I have not seen 7 days. This is a really fast response. This is almost like a steroid, or is a steroid. It has basically anti-inflammatory effects, but doesn't have the adverse effects of psychoses, increased blood pressure, osteoporosis. I mean, it has wonderful effects without the horrible side effects. So it basically acts like a steroid and acts very quickly. And that's a wonderful thing.
Well, you kind of beat me to my next question, because I was going to say, well, why is this important and what are the implications? But you kind of already answered a lot of that already.
Well, the implications are that it can play a role with chronic disease. You want to be able to reverse the inflammation. You want to be able to reverse, treat, and prevent chronic diseases. And doing that, many of the chronic diseases, 80% of them, are based on inflammation. Diseases such as heart disease, stroke, high blood pressure, cholesterol, chronic kidney disease, autoimmune diseases such as rheumatoid arthritis, lupus, Crohn's disease, ulcerative colitis, and neurodegenerative diseases like macular degeneration. Even Alzheimer's and Parkinson's can be based on inflammation, and you want to reduce this. And even more importantly, right now, with the current environment of COVID-19, believe it or not, that's based on inflammation. Whether you're being infected by it or you no longer test positive for it, there can be patients that are long haulers that may have inflammation as their lingering effect. And what you want to do is be able to reduce that inflammation so you don't have side effects and you don't have pain and you don't have exhaustion and you don't have joint pain and you don't have headaches and all of these problems that are occurring because of potentially lingering inflammation from being infected by the virus, but not the virus itself, but the body's reaction with that smoldering inflammation.
Yeah, for sure. And I have to say, I mean, for me, I felt these effects as well. I mean, we haven't measured me, I mean, we've done blood work, between you and I, but I've seen a lot of changes, and it's just, and I've been plant-based, my 100%. There's no ifs, ands, or buts. I mean, I don't eat animal products, unless it sneaks in that I'm unaware of, if I eat out or something like that. But I tend to be very, very selective because I can't handle sodium at all in
Right.
anything. So
Right.
it almost has to be, so it makes it really difficult. So I pretty much take care of my own food with me most of the time. So let's talk about the smoothie. What's the secret ingredients in the smoothie? Come on, tell.
That's a really great question. The most important ingredient of all the ingredients in the smoothie is the half pound or 8 ounces by weight of the dark leafy greens like spinach or baby kale or regular kale or baby bok choy. I find that spinach and baby bok choy are my two favorites. It's important that it's 8 ounces by weight because I found early on that people were putting 8 ounces by volume, and that is a very small amount. 8 ounces by weight is much larger, and that's a key component. And that, when you think about the smoothie, is the dose of what you want to get. And when you think of a medication, you think of dose. This is the dose of greens that you want to get, and that's what makes a huge difference in increasing the nutrient level of the beta-carotene and decreasing the inflammation. And then you add 2.5 cups of frozen blueberries, and fruit plays an enormous role with chronic diseases. So that's very important, especially blueberries. They're wonderful. And then half a cup of unsweetened soy milk or almond milk and half a cup of water and half a banana and 1 tablespoon of unsweetened cocoa powder and 1 tablespoon of ground flaxseed. And this is all wonderful and makes it a really delicious smoothie. So people love it. They absolutely not only get the effects, but they enjoy the taste of it.
That's a lot of blueberries, though. My goodness. I mean, and
Well, it makes it taste delicious. That's the wonderful thing about it. It makes
that
it
is true. But don't you worry about too much sugar coming in from the blueberries?
well, the sugar actually doesn't go up when you have whole fruit. And I've tested it on multiple patients where I've given them a smoothie and then I've tested their sugar an hour later, 2 hours later, and it doesn't even seem to break the fasting level. So your body doesn't seem to recognize it as sugar. So it stays below 100 in terms
Okay.
of the glucose level. And this is wonderful because you would think it would go up to potentially up to 140, which is still postprandial or just after you ate, and it stays between 70 and 90 typically.
So this would be great for somebody like dealing with diabetes then.
Absolutely, someone dealing with diabetes. So I tested it and I found that everybody had 70 to 90, except one patient whose sugar went up to 150. And I said, okay, you're having the smoothie and the sugar went up. They said, yes. And they said, all I did was the smoothie. And I said, that's all you did? And they said, yes. And then I said, really? And they said, well, I have 2 pieces of toast as well. And I was like, okay, that made the sugar go to 150.
Yeah.
But everybody else who just did the smoothie stayed between 70 and 90. And you want to be careful not to use fruit that is canned or in syrup. You want to use fresh fruit or frozen fruit. And the reason for frozen fruit is that it makes it nice and cold. And if you don't want it cold, you can always use room temperature fruit, or you can just get fresh fruit.
Oh, well, how does a smoothie compare to a salad? Like if you're just eating a salad compared to the, in terms of getting the nutrients.
Well, salads are wonderful. I think salads are great. I think they give you incredible fiber and they are wonderful for constipation and they're wonderful for everything except if you have ulcerative colitis or Crohn's disease in the beginning because you don't want to give raw vegetables to somebody who has ulcerative colitis or Crohn's in the beginning, and then you can move to that. You can go from cooked to raw. But in terms of salad being important, when you compare salad, like there was a study done that compared spinach when it was liquefied or emulsified in a blender type effect compared to whole spinach in a salad. And what they found was the absorption was 86% higher than the absorption with just eating a salad. So you get so much more nutrients from, it's almost like eating 2 salads in one. And you can get more greens in a smoothie than you can in a salad. A typically large salad is 5 ounces, and that's a big salad. In this smoothie, we're putting in 8 ounces. So we're putting in 60% more greens, and the absorption is twice as much. So if you calculate that out, you're getting so many more dark leafy greens absorbed into your bloodstream that this is incredible.
Well, you and I have had this conversation before because Dr. Caldwell Esselstyn, who kind of started me on my journey,
And he's a wonderful doctor.
Oh my God. I mean,
doctor.
the program he has at the Cleveland Clinic, and I know, Dr. Robert Otzfeld at Montefiore in the Bronx has started the same, he mirrored what Dr. Esselstyn did, amazing. But
and Esselstyn has been groundbreaking, absolutely groundbreaking.
Yeah.
And a leader in
sure.
the field, absolutely.
And he says no on smoothies, chew your food, that's the better way, that he wasn't an advocate of smoothies. So, that's how I've always been thought of this, and poo-pooed smoothies. So what do you say to that?
Well, I say that not all smoothies are created equal. So Esselstyn is not wrong in saying don't have smoothies most of the time, because probably 99% of smoothies, just because they're called smoothies, doesn't mean they're good. And it depends on what's in the smoothie. Many of the smoothies put in fruit juice. Many of the smoothies are made commercially, so they don't put in very much greens. Many of the smoothies use vegetable powders or canned fruit, so it's too sweet, or may add sugar, or may add agave, or may add too many dates. And so you end up, instead of having a smoothie, you end up like when you say, okay, I'm going to Starbucks and I'm going to get coffee, instead of getting a coffee, you get a mocha chocolate, that type of thing where you get the whipped
Right?
cream and you get the ice cream on it and you get this and you get that. And by the time you leave, it's a 1,200 calorie ice cream and not a coffee anymore. So smoothies, it really depends on the smoothie you're getting and the quality of the smoothie and the dose of the greens, because almost nowhere else are they going to put in enough greens except in your house. And you can tell them to double and triple the greens, and you can explain what half a pound is, but they can't even imagine it because people don't ask for this. They ask for the sweetness. They ask for the color. I mean, these are the important things. They ask for it to be cold, but they're not asking for the nutrients, and they're not asking to get the beta-carotene levels up. And so they're not thinking about this when you get it done commercially. So Dr. Esselstyn would be correct if you were going out and buying it, or if you were putting these substances in it, but not in a nutrient-dense smoothie focused in on low sugars and not adding sugar, but getting sugar from the fruits and getting lots and lots of dark green leafy vegetables and that dose of half a pound in each 32-ounce smoothie.
Why did you use the high sensitivity CRP, the C-reactive protein? Why did you use that as a measurement?
Well, we use the high sensitivity CRP because it's the most well-studied of the inflammatory markers. It's one of the most well-studied. And there were some great studies that were done, and it showed that CRP is not only a marker of inflammation, but can actually mediate disease, can actually contribute to disease. So the idea is to get that marker down, but also to get that mediator of disease down. So if you get the CRP down, not only are you getting the marker down, but you're getting potentially changing the aspect of what's happening with the disease itself. So when that marker comes down, you're saying, well, you're doing well, but you're also changing the mediation of the disease because C-reactive protein can contribute to making it worse. And so we want to use CRP, and we've seen that it can prevent and reverse diseases.
Well, I have to tell you, when I first started this journey, I had gone into my regular doctor, and I said to her that I wanted to measure my C-reactive protein, and then I wanted to come back, in like 6 months or so and measure it again. And she's like, why? And I said, to see the changes? She's like, it's not going to change. I don't know what you're talking about. It won't change. I've never seen it change.
Well, that is a really good point. With medication, the only medication that seems to lower C-reactive protein seems to be a statin or something like that. There's maybe the statins do, and Paul Ritger from Harvard showed that statins can lower C-reactive protein, which is wonderful, but they don't have the wonderful benefits as a smoothie does. They just lower the C-reactive protein, but they don't have that necessarily same benefit as using a smoothie or the life diet change overall. And so you don't see a lot of people lowering their C-reactive protein. And in fact, I had a woman who came in with Crohn's disease, inflammatory bowel disease that was Crohn's specific. And she said, my husband just wants to tell you that I'm eating so well and I'm eating plant-based, but that you'll never do better, and that my C-reactive protein was 6. And the goal for us was to get it less than 3, which would be average to get it less than 3, but really less than 1. And so we were working with her, and in a very short period of time, we were able to get the C-reactive protein to less than 1, which is optimal. And she was like, wow, I thought I was eating plant-based. And I was like, you were, but you weren't nutrient-dense plant-based. There's a huge difference. And that's why I emphasize when I say life diet, that it's low inflammatory foods everyday diet, because there's a big difference between being whole food plant-based and being focused on foods that actually can reduce that C-reactive protein.
I was persistent and made her redo my C-reactive protein it was about 6 months later after, I started down this journey. And when it came back, her response was, well, the first test was probably bad. Really?
That's amazing. That's really amazing.
I didn't get any credit at all.
That's amazing. Yes. People will say that. I mean, I've had people reverse heart disease and they go to the cardiologist, and the cardiologist measured their carotids, and they saw a huge difference in their carotids, and they were opened up more, and they didn't have the plaques in their arteries anymore. And they said, this is wonderful. And their inflammation went down. And they said, this was wonderful. And then they said, but you can't reverse heart disease. It's like, okay, that doesn't even make sense. But also, you know, when you stop animal protein, that can help reduce C-reactive protein too, because animal protein is inflammatory. So there are other components that can play a role in reducing C-reactive protein with a whole food plant-based diet. But this specifically has the most, I think, intense effect on what happens to the C-reactive protein in terms of making it go down, in terms of this direct relationship between having the beta-carotene, the serum beta-carotene go up, and then you see that the C-reactive protein goes down. And that is tremendous because you see it from the dark green leafy vegetables, and it's quantifiable, which is something that we don't do very well in nutrition, is able to quantify something and specifically point to say, okay, it's this substance or these substances specifically that does it. It's not just, oh, overall, but it's these substances specifically that have a big impact. And I think that's tremendous. And it's not saying supplements or something like that, but it's saying actual foods that you can go buy at the supermarket.
I know, but I wanted to give at least some credit. Just a little, no, I wasn't asking for just a little acknowledgement that I was right. Just a little bit. Anyway.
Acknowledgement that you were right that the CRP could come down.
Yes.
Yes, and I think you deserved it. So why don't we go back together to your doctor and say, excuse me, but her CRP went down because she worked on it. She worked her butt off. She did a great job. And, you know, I mean, the reasons people will say, oh, this test isn't right. Well, you know, it's easy to write it off, but you worked really hard and you deserve credit for it. And that's wonderful.
But I didn't get any validation from her, but anyway.
Well, I'm giving you validation. This is tremendous.
Thank you, Dave.
Great. And you know this is great. And you know what you can do. And you know the truth about the fact that you can lower CRP. And that in conventional medicine with medications, many of them don't lower CRP, like we said. But in the lifestyle, you know, it's the effects are just tremendous.
Yeah. So does this study, what do you think, apply to a population at large? What do you think?
Yeah, you know, this was a small study with 16 people, and you would think, no, it can't apply to the population at large. I mean, usually studies are all men, and this is 16 people, so you got to guess this is all white men, and it doesn't really apply. No, that wasn't the case. A little bit more than half, about 55%, were women. And it had a population that included people who are white, people who are black, Hispanic, Asian. I mean, this was tremendous for such a small study. To have that population is great. And the people who changed their diet, the life diet completely, were older, and they were a mean age of 65, whereas the people who did the smoothie and just added to the diet that they were already doing, their regular diet, they were 49.
Well, what are some of our takeaways from this study? What have we learned?
You can have rapid reduction in inflammation with small changes to your diet by adding a smoothie. And what you want to think about when you think about this is when you take a medication, you give a medication to somebody and you say it's the dose and the frequency of when you take that medication. So if I give you a medication and I give you 20 milligrams of a statin and I say, take it every day. If you take it every other day and you take 10 milligrams, it's not going to work the way we want it to. However, it's about dose and frequency. So the dose in this case is having the ½ pound of greens, the 8 ounces of dark leafy greens. And the frequency is doing this smoothie every single day. And you'll get the effect you want to see. You'll get a reduction in inflammation and an increase in nutrients. And it's simple modifications that you're making, and yet you get significant reductions in the inflammation with a 32-ounce smoothie. And the benefit of a life smoothie may be the potential of higher rate of absorption. So when you're doing it, you know that you're getting more nutrients with every sip you take as compared to other forms of getting foods. So the vehicle is very important. So getting a smoothie in is a wonderful thing. And I'm not saying don't chew your food at any other points in the day, but I'm saying if you can, do at least a 32-ounce smoothie that's nutrient dense with a lot of greens in that 8 ounces. But I'm also saying you can chew your food, you can have salads, you can have steamed or roasted vegetables, and you can have lots of different food as well, and you can have bean pastas, and you can have these foods. It doesn't mean you have to exclude them, but you want to do this smoothie because it has the most bang for your buck.
First of all, Dave, that is just incredible. All the things that we're getting from this smoothie, because honestly, and I can verify and testify to this because you started me on this, and I was very kind of, okay, I'll do this for a week and we'll see, kind of thing. And we did blood work right away, and we saw like the changes that you're talking about. But, and I was 100% plant-based to start. And one of the things that I had noticed, you started me on this Tanita scale, and I bought one of those, the multi-frequency ones, and I started measuring my bone density. Now, I had been measuring it for a while, and it had been going down, and that was concerning to me. And as soon as I started on the smoothie, that's the only change that I made, and I saw my bone density going up. So, like, a lot. Like, I've regrouped on so much, in terms of my bone density. It's like, wow. And it's not like I've increased my amount of exercise or load-bearing weights or things like that. I've kind of been, constant throughout. I mean, I exercise and things, but, just to see my bone density change like that just by this one difference. So, yeah, I'm a believer, and I'm seeing changes in myself. That and my husband as well. So both of us have that to say about the smoothie, because my husband makes it. He gets it too. If I'm getting it, he's getting it.
That's awesome. That's absolutely awesome. And the great thing about the smoothie is that, and we didn't cover this, we didn't mention this, but we can add it, is that you can make smoothie and put it in the refrigerator and make 4 days worth of smoothie by running 64 ounces in a blender like a Vitamix, the Ninja. If you use the Ninja or you use a Vitamix, you can make 64 ounces at one time, split the smoothie in two, make 2 of those. You don't have to clean the blender in between, and then put 3 of them in the refrigerator and drink one day, and then the next 3 just take a spoon and thin it out the next day, and you can continue to drink them, and they stay nutrient dense, and it's wonderful. You can also freeze them. My brother and sister-in-law freeze them so that they put in a bunch in the freezer, and then you can take them out and put them in the refrigerator the night before.
I want mine fresh. Nope.
Oh, so do I. I prefer fresh as well. Nope. But I've had smoothie where...
And what about the enzymes? I mean, once they're broken open, don't you have like 20 minutes?
No, it stays very good for a while. It's amazing how it works. I've seen that people do this all the time and their nutrient levels go up. Just so you know, the normal nutrient level for LabCorp, for instance, for the beta-carotene is 3 to 91. And my brother has been doing it with freezing the smoothie and then drinking it later and keeping a whole bunch in the refrigerator for a week or 2 at a time. And his nutrient level is 210. His wife was 185. His was 210 or something like that on a scale of 3 to 91. So it was more than double the normal range. And they're putting the smoothies in the freezer and then taking them out and putting them in the refrigerator. So it really does hold its value. That's really great for people who
But I still like it fresh.
So do I. Absolutely. That's my preference. Absolutely. I mean, which would you prefer? Would you prefer to go to a restaurant that makes your food fresh, or would you prefer to go someplace?
Well, I still eat leftovers anyway, but anyway, I prefer my smoothies fresh.
And I prefer my smoothies fresh too. I'm a smoothie connoisseur, and I love to have my smoothies fresh. But if I can, it's fine. And sometimes I can't. And I put smoothies in the refrigerator at work, and I drink sometimes 2 smoothies a day because I'm nuts about the smoothie. I really love the smoothie. and it really helps to wake me up. And they may be sitting in the refrigerator for 48 hours, and I can shake it and it thins out in about 3 shakes, and it still tastes delicious. It's not as good as the fresh one, but I mean, in terms of taste, but it's pretty damn close. And pardon me for saying that.
Well, David, thank you so much. Congratulations on getting your study accepted for publication. Well done to you. And I can't wait to see the 3rd trial.
Yes, I'm hoping to get out several more papers in the next couple of months.
All right. And I look forward to hearing about those. So thank you so much.
Thank you for having me.